Good morning, good afternoon, good evening, wherever you are in the world. Thank you for joining us here. Today, we have a wonderful cast of speakers and experts to talk about the role of urban transformation in catalyzing the brain economy transition. We have wonderful speakers across academia, think tanks, private sector, and various different types of industry. We are holding this webinar in the context, it's a Euro-Mediterranean Economist Association webinar in partnership with the Global Brain Economy Initiative. This webinar is in the context of the World Economic Forum's Brain Economy Action Forum. And a new addition is that this is also in the context of the new Nature Medicine Commission on Brain Health and Economic Resilience. So very much rooted in science today. This webinar is and taking science into also action and practice. Why are we talking about urban transformation? Because urban context is where the bulk of humans live. 56% of us live in urban environments, and it's increasing to 70% by 2050. And urban contexts are responsible for 80% of the world's GDP. The urban context is, I think, for us in the brain economy, the right scale to talk about that's tangible and comprehensible. It's not too big. Sometimes economic transition can be a little too diffuse and nebulous, and it's not too small. Urban contexts are really that really critical sort of economic engine and driver, and we know these contexts as well because we're in them very, very regularly. And so today we want to have a very generative conversation and set of discussions. I think this will be very creative given all the different experts we have on the line, some of whom have met, some of whom have not. We are working very much in earnest to ideate on a brain economy cities initiative with the World Economic Forum's Center for Urban Transformation and Jeff Merritt. So hopefully today that this conversation will feed into that and making that more robust and more impactful. And so without further ado, I'd like to get started with expert inputs. I would like to invite Kana Enomoto, Director of Brain Health at the McKinsey Health Institute, to open things up and share her perspectives on place-based brain economy transitions. So thank you, Kana.
Great. Thank you, Harris. Thank you, Rim, for the invitation, and excited to see you all this morning. I am Kana Enomoto, Director of Brain Health for McKinsey Health Institute, and I am going to do my best. You can all see my screen?
Yes, we have it now.
Somehow I'm not full screen. Hopefully this will do. There we go. So as many of you know, we launched the report together with the World Economic Forum and the Brain Economy Action Forum in January at Davos, looking at the human advantage, stronger brains in the age of AI. And this overall, we are talking about what is the role of brain capital as our economies, as our systems and our technology are so rapidly evolving. And the idea that brain health plus brain skills, for those of you who are new here, comprise a foundational economic asset that is going to drive competitiveness and prosperity in the next generation and even today. And the work that we have done has looked at a macro level, looking at the global burden of disease or global opportunity within workforces and for employers and then GDP. But we know that sort of as all health is local, the brain economy is also local. So we have been thinking about what does comprise a place-based initiative where you can drive and strengthen brain capital locally in order to shift systems and economies globally. So what we've been thinking about is that these localized multi-stakeholder efforts are ones that strengthen brain capital in a geographic area. They're going to address root causes, root drivers, both tailwinds and headwinds for brain capital, looking at education, healthcare, workforce, and others. And I'll walk through sort of a model that we have there. And then bringing together I think what's really exciting about some of these galvanizing efforts that we're seeing is that they are facilitating collaboration across these different sectors to develop the locally appropriate and tailored solution where 1 + 1 = 11. It's not 2. And because they are reinforcing to one another and then they're creating synergies that are amplifying impact. So the real world labs or pilots that we're seeing popping up around the world are very exciting, where folks are trying new things, they're measuring, they're refining, and then replicating. And I think we're super excited about the brain economy, brain capital index, because that's going to be even more important as folks are doing this and wanting to really understand and measure their impact over time. And then we're targeting, this gives us the ability to do that brain lens investing, where we're targeting resources where the needs and the opportunities are greatest and where the impact on the brain, whether that's on the health side or the skills side, are the greatest. So how can a place-based approach work to build brain capital? It starts by recognizing that brain capital is shaped by multiple sectors within a community. So here we just identified education, health, government, banking and finance, both the built and the natural environment, arts, culture, media, civil society, so nonprofit advocacy, leadership, as well as businesses, so employers, but recognizing that and employers in the private sector and the public sector are also vital as they create the conditions in the workplace, as well as the pipeline for our people as we are developing their brain capital. The pillars on the left-hand side that you see are really cross-cutting. Those come from the work of the Brain Economy Action Forum and the WEF report, where we safeguard folks' brain health, we're fostering their skills, we're studying brain capital itself, we're investing, using that brain lens investing to invest in those opportunities and those things that are advancing brain capital, and then mobilizing. And in this case, it's not just mobilizing globally, but at the local, regional, national, and potentially global levels. So that's where it's exciting, and we're seeing this action taking place across continents. And so these place-based approaches are extending their impact, they're radiating their impact not only across sectors, also geographically, and then the different levers of brain capital really, I think, cross-cut each of the sectors and the regions. So one example is if we're looking at a university and what role they could play in building brain capital. So I have 2 examples. One's a university, one's a municipality. But here, it's not dissimilar, right? There are different roles that any entity or any region could be playing, right? Like you're looking at what is your role as a member of this community, in this region, in this state, in this country. What is our role in this case as a university? They have a role in shaping the brain skills of the next generation, of thinking about how is this affecting their research and their innovation engine, like what is their role in advancing understanding of the brain, but also how does the brain play into other disciplines, other areas of the university's work, and how can they foster the brain skills and build brain capital across their research enterprise. This dovetails with, again, whether you're public or private sector, you still have a role as an employer. How are you creating the conditions to support your employees, whether they are the high-level faculty or they're your facilities and your IT, the backbone and the infrastructure of your university? All of those folks are contributing to the brain capital, both of your enterprise as well as their community. And then for many universities that are academic medical centers, how are they ensuring access to high quality care for folks in their community as well as on their premises and for their employees? So this is a place-based if you're taking it from an organizational level. And then here is a real world example that we are borrowing from our friends in Chile, a municipality in Santiago called Renca, has taken a very place-based approach to building brain capital from birth to adulthood, where it's one of the poorest municipalities in the city, but it has a mayor that has a vision that by investing in brain health and the brain skills of its residents, that they are going to elevate, right, their economic standing. And so he sees brain capital as an econ development initiative. And so just as an example of one of their an overarching initiative that they've taken toward young people is really going across the lifespan. So this is illustration right from the hospital. They're starting with early childhood and actually prenatal support for expectant mothers and families, and up through the first 3 years, focusing on healthy development and family attachment. Then they're going to preschool. They're offering free preschool and providing incentives to families. I think it's like if your child has 98% or above attendance in their preschool, they give a payment of what's like equal to about $100, and they have massively had like 50% increase in the number of children who are actually achieving those targets. They did Renca Reads, which is my first book. They give every child a book in their community, and then are fostering literacy. They're introducing them to the arts, and they bring children to the municipal concert hall. They've also invested in a concert hall for the community, and so they bring in a symphony so that they can attend a concert and give the children exposure to music and creativity. They're investing in their physical health, introducing sports and structured recreation. They did My First Robot, so they've brought in employers and technology companies to start building technical skills of their young people, starting in 6th grade with a focus on STEM and digital. And then outdoor and experiential leadership learning starting in middle school. So that's just a picture of that. And then a piece where I'm going to double click on is an initiative that we partnered with them on for high school students, really addressing the mental health through evidence-based task sharing using the common elements treatment approach. And so in this city, they are making now mental health supports available universally to all 9th graders in all of the schools, whether they're public or private in the municipality, because they've done this pilot, which has seen virtually everyone who participated noticed improvements in their well-being. This is a measurement-based care model assisted by technology, implemented by both psychologists and trained lay professionals in a really structured intervention that's transdiagnostic. They're seeing folks achieve massive reduction in symptoms. I mean, 82% symptom reduction relative to baseline is incredible. It's highly monitored with a technology platform, so they're seeing 100% fidelity to the intervention. Folks are staying for 8 to 12 sessions. Prior to implementing this program, they were seeing people only attend 1 or 2 sessions of outpatient care, and then the wait time, of course, they cut that in half. But what's really relevant to us here in thinking about brain capital is that as we did McKinsey Health Institute looked at what is the ROI when you're seeing kids staying in school, reducing suicidality, staying out of criminal or juvenile justice involvement, being more ready for work and longer term employment. It's a potential 17 to 18x social return on investment when you take into consideration the future earnings of children, their lower healthcare utilization, and increased caregiver participation. We saw leading indicators of that just in this pilot, but I think as we develop more and more examples of comprehensive place-based approaches, this will generate, I think, more excitement around the world for other leaders who can see the opportunity to build the the economic health of their communities through focusing on the brain. That's it for me. Please join the dialogue, join the action forum, and our friends at GBEI. So, thank you.
Thank you so much, Kana. That's I think extremely helpful introduction for everyone to the brain economy, for those that haven't learned about it before. Helpful strategic framing, and then some really nice tangible case examples, and wonderful also the ranker example is in the global south, and there's so much that we can learn from that. So really terrific start. Thank you. And now I'd like to turn to 𝗕𝗄𝗍𝗍, the founder and president of EMEA, the Euro-Mediterranean Economists Association. Rim, welcome your intervention, and excited to see what you're going to share today, because it's going to be a surprise to me. So I'm excited. Over to you, Rim.
Thank you, Harris. Great to see you all. My presentation will complement Kana's comments. And in fact, I'm doing a reflection on brain capital measurement, so the index, and urban transformation. So how can we include urban thinking into the dynamic of brain capital measurement? So I prepared a few slides, which will be played by Danny. So Danny, please follow the next slide. Do you see my slides, Harris? Because I don't.
Yep, we can see it, Rim. It's on the second one now.
Okay, perfect. So practically, as shown in the work that we have developed in the Brain Capital Index, brain capital is built through 4 interconnected systems of enablers. So this is what we call Pillar 1, which is the brain capital enablers. So this is, we need to go to slide 2. So these are health and well-being systems to protect the brain, and these are health and well-being overall, in which we manage to measure. And it includes practically access to mental health services, primary care, preventive health spending, and also broader activities related to how we can monitor, how we have the infrastructure in terms of the health systems to understand neurological and mental disorders and how to treat them and prevent them, so within hospitals. And in fact, because of the brain or healthy brains are foundational to productivity and learning and resilience, it is so important to have this first, what I call the enabler pillars. And the second one is the education and skill systems. So of course, this is how to build our brain capacity, and this comes within the infrastructure within our, for example, the education from life and to lifelong learning, and also the infrastructure within, so the universities, for example, the digital infrastructure that we have. And all of this which allows us how societies can build their cognitive abilities. And this is, in fact, the more we invest in those enablers, the more we expect brain capital through the skills part to be enhanced and to be continuously developed. And then the third one, which is the third enabler group, is the innovation and economic systems overall that activates the brain capital. And these are what we call the innovation and the economic environment. So, for example, the capacity of an economy to develop research and development, the institutional setting, also the ecosystems for entrepreneurship, for venture capital, for also the readiness to artificial intelligence and all the infrastructure behind. And this is really to will allow us to determine whether brain capacity is translated into value. So, for example, we looked at it in the brain skills part through, for example, the patents. And in reality, without innovation ecosystems and research and development, our brain capital remains in a way underutilized. And here, whatever we do in terms of investment may not go into a value that is tangible value for our societies and economies. And the fourth part, which is the social, institutional, and environmental systems, these are really sustaining the brain. And this is what we call the overall environment. And the overall environment, and this also is linked to, again, the environment we're living in, the availability of green and blue spaces, the housing, the quality of the housing we're living in, the safety, the overall inclusion within a space where we live, and all of this is shaping, in a way, our brains and our lives every day. So in fact, brains are shaped by their environment, and here comes the central role of cities and urban areas. So, and in fact, this brings me to a foundational observations. Cities are where all these enablers converge in a systematic way. And we need to think here in a system-based approach. In fact, they shape how we move, how we interact, how we connect, how we think, and how we feel, and how we also maintain our brain health. For example, the transportation system, they affect, of course, stress and times, how they are organized. The urban design affect overall mental health. Our innovation system, as I mentioned, drive the knowledge creation. For example, also the cultural and artistic expression within a city also shapes our brain, and all of this within what we call the social, cultural, and art infrastructure, which shape overall our evolution. So cities are not only a place to live, but they are systems that shape the human potential and brain capabilities and brain health overall and brain capital. So keeping this in mind, I would like to share with you some of the key insights, and I will go fast on those, from the Global Brain Capital Index, which in fact show how in a business as usual scenario, we don't take into consideration indicators of what I talked before. So really getting into the capacities of our cities to shape in a positive way our brain, because simply we don't have this data yet. And my call to you today is to start really thinking to measure these aspects within your respective interventions. So if we go next to the next slide, Danny. So this is the first slide on the overall brain capital that has been, in fact, more vulnerable since 2010 overall, simply because there were not the appropriate conditions, in fact, to shape our global brain capital into an upward trend. So this is slide number 5, just to make sure, because I don't see the slide on screen. And then the next slide also shows this, in a way, divergence between OECD and non-OECD countries, but then also at the same time, all world is shaped by the same trend. And this is also, in fact, something to look at it. But then at the same time, we can see that some of the countries which are, I would say, non-OECD countries, they could eventually, if they invest, they could converge to a higher level overall in terms of brain capital. So the next slide, and this is, in fact, the brain enablers. The brain enablers, they include these 4 dimensions that I mentioned before, and they are overall going down, and they are extremely sensitive to economic shocks. So in fact, when there is an economic shock, the investments overall on our brain infrastructure means education, health systems, innovation systems, and also environment go down. And this, which is clearly, we need to avoid this over the years, and we need to really continue as much as possible measuring those aspects, so we keep a buffer and we don't so these are not reduced over time. And the final slide from this group of slides, which is the brain health under global strain. And this is clearly that all these trends have led to a decreasing brain health overall globally. And this is worrying, and we need to revert such a trend. So one observation that emerges, and I would like Danny to share the next slide. Countries with strong institutions, governance, inclusive policies, and resilient enable environments are much better able to protect their health during crisis. And we've seen it in certain specific cases. And in reality also, they can translate brain skills into economic and social outcomes and sustain long-term development. And these are all linked to, again, a resilient enabling environment. So, and this is one of the preconditions or the key pillar for brain capital index. So I just wanted to give you a concrete example, which is in fact connected to a project that Euro-Mediterranean Economists Association is involved in as a knowledge partner, which is the Community for Living Area project. And this is a community project, Euro-Mediterranean Green Living Areas, which in fact allows a number of projects and stakeholders, and this is completely aligned with the place-based approach that Kanna mentioned before, that work together to transform the Mediterranean cities into greener and more resilient living areas. But again, brain capital is not part of this yet, but then we could link it by connecting the knowledge that all the cities have developed over time, and then we can frame it, obviously, and this is what we're trying to do, into a brain capital, which in fact enables the scaling of the solutions that could be proposed to the cities, so to the municipalities across the different territories. And then, of course, this could underpin all the thinking of brain capital, of course, which is connected to the 4 enabling pillars that I mentioned before. And in doing so, in fact, it shows that transforming the way we live in cities is also about strengthening this concept of brain capital, which is really making sure that people are adapting within and thriving within their own cities and overall society. So, in fact, why I'm giving you this example is from the enablers. So the 4 aspects that I mentioned to you before into a system thinking. And please, Danny, go to the next slide. So just to make sure, yes. So, and then this is where the index provides, in fact, a shift from the current paradigm that we are living in, which is the business as usual scenario, into a brain capital positive scenario. And this really drives us from an individual thinking and silo thinking approach to a system thinking. And I believe that cities could be the right way to frame this. And I am happy to hear that you have this brain positive city initiative, which really is the right way to proceed. So my last comment is really to show that we can act within 5 levers for integrating brain capital and urban transformation. Number 1 is to embed brain health into urban planning. Number 2 is to redesign mobility for cognitive efficiency. Number 3 is to build social infrastructure for connection and connectivity, and align economies to brain capital as much as possible, including some matrix, so for example, this index or other similar indexes, to monitor the evolution over time at the city level. And we have a bunch of indicators that we would like to see, but again, the data is not available. And finally, to govern brain positive cities using this specific adjusted matrix to brain capital. So with this, I would like to stop here, and we can go a bit further into the specific indicators that we would like to see at the city level. And these are, they should be, of course, measurable over the years and also actionable to ensure that we have a clear impact on the cities and also on all the regions, the territories of the countries that we mentioned. Thank you, Harris. To you.
Wonderful. Thank you so much, Rim, for bringing measurement into this. And I think we have a lot of work to do on measurement, and we'll be doing that certainly partly through the Nature Commission, Rim, where you lead the measurement work group. Then also bringing some case examples. And of course, we know that we've seen great work from you in the Catalonia region and in Barcelona, but also many cities in the Euro-Mediterranean. So thanks for bringing all of that as we go forward with this initiative to bring together global cities. Without further ado, I'd like to invite Marco Lucasano to speak next. Marco is SVP for Built Environment at Swedish RISE, the Research Institutes of Sweden, which is doing some very interesting work. So over to you, Marco, to take it away.
Thank you very much, Harris. It's a big pleasure to be here discussing the most valuable asset of the present century. My name is Marco Lucasano, and I represent RISE with an S, and it's always a tricky thing when speaking in the same seminar as Harris. But RISE with an S is Research Institutes of Sweden, and we are a state-owned incorporated entity, and together with my 3,000 colleagues, we act as Sweden's collaborative engine for applied research and innovation. So in respect to the subjects that we are discussing today, we occupy the space between the laboratory and the street. And today I'll suggest that the city is not just a collection of houses and infrastructure, but a kind of biological intervention. So the question for us, in a way, is rather simple. Are we designing actively for cognitive depletion, or are we designing to make people flourish? And I, of course, hope that the second option is the direction we are moving towards. And we have heard earlier today that 70% of us is going to live in urban areas soon. 2050 is very soon when working with the built environment. Therefore, we are effectively moving in a direction where the human species becomes associated with a synthetic habitat that we have to design for. And our understanding of the brain economy is that we want to have innovation and mental adaptability to drive growth. So cities, as we have heard from the previous speakers, become an active ingredient in developing human potential, not only focusing on the aesthetics and the functionality as of delivering services, but also delivering a kind of catalyst for productivity and health. And I'm trying to do two things at the same time. And of course, neuroscience right now is exploding in a way. And we see neuroscience studies developing everywhere, and they're getting better and better. And neuroscience is a brilliant living discipline that will and must continue to develop. Personally, I feel that it's an exciting time to live and being transported in this flow of new insights. And what we try to do at RISE is to take the mission to put neuroscience into operation. So we're bridging the gap by taking neuroscience data, both those that come from historic breakthroughs and insights generated today and tomorrow, and converting them into practical tools for planners. And crucially, our way of working is that we are not waiting for the science to be finished before we act. We work in parallel and in a continuous feedback loop with scientists and application, so that the scientific developments and measurement technologies can be applied in the real conditions as they are developed. So we are, in a way, building the bridge at the same time as we are crossing it. So I'll try to give you a concrete example, and this is from the city of Stockholm, where I live. This is the street of �11Fridomsgatan. And together with our research and development partners, we are right now working on this very street. With all of its cars and transports and sirens and buses and underground stations, both the ones that are there and the ones that are being built right now. In a way, it is a very ordinary street, and that is most possibly the reason why I'm lifting today, and it's a focus of our research, because it is ordinary. In the illustration that I'm showing right now, you see the addition of a pocket park. And if you are in the urban development area, you might realize pocket parks, that's something we've been doing for the past 20 years. And that's correct, yes. And the difference is that we possibly have not been doing them with this level of scientifically validated evidence that we have today. So our work is about putting scientifically validated hard data on cause and effect. And we are doing it with the city, with the region of Stockholm, with real estate developers and planners. And to our understanding, this is the very first time in the Swedish context that this has been tried, and it's going on right now. So we are collecting the information that will allow us to have RNI calculations as solid in their scientific validation as they are in their financial logic, and the possibility to take informed decisions out of those. And what we learn in a single street in Stockholm shall not stay there, of course. And I was listening to the previous speakers, and I'm convinced that if there is a superpower for scaling innovation in this setting, is the city-to-city collaboration. This is a superpower that cities have been developing for the past 20, 30 years. And when correctly exercised, cities apply general rules generally, while at the same time having focus on the specifics of every different reality. So Stockholm is, for example, a leading node in a very powerful network of Swedish cities. It's called the Viable Cities Network. Their mission is to create climate-neutral cities 2030 with a good life for all within the planet's limit. And from there, we are plugged in 100 climate-neutral cities all across Europe. And from there, for example, into the global covenant of mayors worldwide. So there is this scaling pipeline that we know how to use because we have been doing it for the past 20, 30 years. So this network is an engine for scaling up into policy, but also scaling out across geographies. Because these cities do share a common language of cooperation and can bypass a lot of the friction of implementation. So we are building a railway so that breakthroughs that, for example, in this specific project come from Stockholm and can become a standard in other cities with speed and at scale. So when we plan today and we are working with the built environment, we are planning for the next maybe 100 years. And in some planning system and planning cultures, it can result in a kind of planning anxiety. But anxiety is not the driving force for impact. Movement is a driving force for impact. So the brain economy needs cities that do act as dynamic living laboratories to cultivate human cognitive capacity. And narrow architecture and narrow science is a tool that gives us the science to stop designing by intuition alone and start designing with intention and data and analysis on impact. So I'll close here, and I hope that we are not afraid together and together with the people that are listening to be a kind of prime mover and do initiate new projects. So I do invite everyone, when you think of your upcoming project, to see it as a catalyst for the brain economy and see what we can learn. It might not be perfect, but it will move knowledge forward. So thank you very much.
Thank you so much, Marco, for that overview of the work you're doing, and acknowledging also that you have a new international center for neurodesign and neuroarchitecture with RISE and UCL, which is very impressive and has a number of wonderful scientists and practitioners. And I guess it's important to mention that next week, on the 5th in Brussels, you will be co-hosting the European Brain Economy Summit. And so thank you to RISE for supporting that event and for bringing this perspective on urban transformation to Brussels, which hopefully will propagate around the European Commission, European Union, but then also through the G7, given it's a summit in the context of the G7 French presidency. And Marco, you will be there, and also the first speakers, Rim and Kana. So if anyone that's listening is interested, there is still some room there at that summit. So anyway, thank you very much, Marco, again. And we also take your motivation and challenge to us to keep persisting on some sort of initiative around brain economy cities. So thank you for that too. And so now, speaking of case examples of brain economy cities, brain positive cities, David Gao is here. We slightly reshuffled the order. David is the CEO of the Center for Houston's Future and the operational lead for Project METIS. And David, over to you to share with us your real living lab there in Houston, Texas. Thank you.
Great, thank you, Harris. Great to be with everybody here. And as Harris said, and most of you know, we are a place-based initiative. We are working to make brain capital a reality and strength in our Houston region, and ideally turn Houston into a lighthouse for brain capital. We have defined the initiative this way. It's a holistic initiative focused on lifelong brain health with the two objectives of human flourishing and economic growth. And the power of the work we're doing is really born out of the people we've been able to bring together. So we have lots of the leading medical institutions in town, some large corporations, nonprofits, a sweeping set of parties who are committed to enhancing brain capital in the region. Our three chairs include Jochen Reiser of UTMB, Amy Dittmar of Rice, and David Callender of Memorial Hermann. And then we've got some other wonderful top flight institutions who've all come together to enhance Houston and have our place-based initiative really bear some strong outcomes. Under that big umbrella topic, lifelong brain health for human flourishing and economic growth, we have divided our work into 7 teams. 3 of the teams are delineated by where you are in lifespan. So we have each of these teams populated with about 12 to 15 people. We've got a team on early brain development, workplace years, and healthy aging. And then we've got a team on science and prevention, commercialization, measurement, and marketing communications. And what I thought I'd do with my few minutes here is just highlight some of the outcomes, some of the work that we're doing on these individual teams. And so for the workplace team, what we've got is a community of folks who have come together, and what we're doing is first designing what's really relevant. What are the best interventions, the best practices for a brain-friendly workplace? And of course, when we think about these solutions, we're playing defense and offense. We're working to reduce incidences of mental health problems in the workplace, and also for otherwise healthy brains, enhance productivity. And so we're designing interventions to create more total productivity from the brains in the workplace. We're going to implement those interventions, our best practices, in willing partners. We're going to track results with tools that are coming out of the measurement team. And then, of course, our intent is to take great outcomes, returns on investment, and share them with others. One of the great things about our work here at the center is that we are co-located with the Greater Houston Partnership, and so there are literally hundreds of member companies. And so if we can get this right in our pilot parties, if we can design, implement, and track results that show meaningful outcomes, we have a great community here where we can share those outcomes and then enhance the total impact. That's the workplace team. I might highlight a few others. We do have a marketing communications team, and one of the things we thought was important to do is to try to build better brain awareness amongst our population. So this site, and I invite you to come and take a look at it, is not written for the insider medical scientific community. It's written for the general population, trying to encourage people to be more brain savvy, more brain aware, just as they think about their physical well-being. We want them to be more mindful and cognizant of their mental well-being. The marketing communications team is also putting on our big summit, and we think our summit on June 9th and June 10th is a wonderful opportunity to bring people together, educate them on this opportunity for brain capital, and activate more parties to bring in more people under this big tent that we're doing here as a place-based initiative. Invite you all to come. It's June 9th and June 10th here in Houston, and I can share more later. As I mentioned, we've got a metrics team, and of course, measurement is such a core part of everything we hope to accomplish. The metrics team is working on two different metrics. One is a community-wide brain capital index. The other is a corporate-specific metric. We focused first on the community-wide brain capital index, and we do have a first draft of that, but we know it's going to be enhanced greatly. I want to highlight RIM's work, the great work that's happened with EMEA, as we've been able to do this so much faster because of their lead. I know that there were probably dozens, if not hundreds of questions they wrestled with on what to include, how to include it, how to do the right normalization, et cetera, et cetera. We've been able to leverage their work and their experience to get to a good outcome here with a community-wide brain capital index that we can track over time. And then we'll get to a corporate brain-specific metric where we're tracking brain capital within a corporation. But our first pass looks like this. One of the great things about our metric here is that we're able to track it down to the zip code level. This is a representation at a county level. Harris County is really the county that surrounds Houston. And so what we can do is compare county to county, and we've got Harris County versus the United States versus the state of Texas. Now, this is a first pass. Thanks to RIM, we're upgrading it with additional data sources. And the intent is that at our summit on June 9th, we'll have on the stage RIM sharing what she's done globally, and then a woman from our team sharing what's been happening here locally, statewide, and nationally here in the US. And so we're very excited about the opportunity to share and contrast brain capital over time by marketplace. And we do think that'll lead to lots of fruitful conversations and likely open the eyes of some city regions to a need to really invest and double down in brain capital. So the way we think about our position, we are calling it Project Metis. Of course, that's a Greek goddess of deep thought and wisdom, and it is a place-based initiative. And what we're trying to do here is to take all the best thinking and concepts that have happened from many of the global players like EMEA, like the World Economic Forum, take a lot of the great conversations that have come out of Davos, the best thinking, and implement them amongst partners here in Houston to concentrate them, focus on our place-based work. And as we do, though, we can go that full distance from design, implementing, tracking, and sharing results. And when we get to great outcomes here, we'll then come back and share them globally. So we're excited to work collaboratively globally and to implement locally. And ideally, what we'll be able to do over time is enhance brain capital in our region and share a blueprint that will enable us to be a lighthouse to enhance brain capital in other places.
Wonderful. Yeah, wonderful overview, David. Thank you. Very interesting to see how this can manifest in a specific city, and the outputs that you're generating in a short period of time are tremendous. So it's a great model. And thank you for hosting the Texas Brain Economy Summit in June. And a number of us will be there, plan to be there already. And then there's an open invitation for others to join. It will be a big event held in the context of the American G20 presidency, and the great complement to what's happening in Brussels next week to be then in Texas the following month. Okay, next to 𝗬𝗨 Nanda, who's Executive Vice President for Innovation at HKS and the Global Sector Director of Innovation. 𝗬𝗨, you have so many big titles. I'm trying to keep up. 𝗬𝗨 is also a professor of practice at University of Michigan, and very importantly, the founder of the Building Brains Coalition, which is a wonderful network of actors in the space of urban transformation writ large. 𝗬𝗨, over to you to share some perspectives on place and perhaps the Vital Cities model that you've developed partly with Project Metis.
Will do. Thank you so much. And I also want to call out Devin and Helia, Perkins and Will, and Arcadius, who are also part of this coalition, and of course, Marco. I'm thrilled to have so much built environment representation on this call. So thank you, Rim and Harris. And Kana, when you were sharing your slide, the joy it gave us to see built environment and natural environment as part of the model. That by itself is a paradigm shift. It's a huge paradigm shift. And if my internet went off and the world went dark, I would still be happy that we were here because so many people have called out to the role of the built environment. So can you see my screen?
Yes, it says sharing. So it just arrived. We can see.
Perfect. So very quickly, I'll build on the narrative that has been so beautifully set in place by all the previous speakers, and really give the provocation on the role of the built environment and the brain economy, and think about it in terms of really building brains. Can we build for brain health, brain skills, and a brain economy? I want to call out that for us, it is thinking about heart health and brain health together, and never forgetting the role of place. Somehow, the most visible part of our lives, which is the environment around us, tends to become a little invisible to us when we have these strategic conversations at a policy level. And our role is really to make that evident again, and a powerful lever. We live in an interesting time where we pay so much attention to what goes into our bodies, about nutrition and diet and pharmaceutical. They're so careful. And yet we are very mindless about what our bodies go into. We live in cities and environments that are actively working against health, well-being, cognitive health, well-being. And I wonder why that is. It's like a visible layer that has been invisible to us for a while. And yet the evidence base has been growing over time and is compelling around air quality and depression, around air quality and heart health, around car-dependent infrastructure and social isolation, around the design of our cities and simple noise pollution. We know that this is out there, and yet when we talk about brain health and brain skills, we don't always talk about it. And we can take it from the city scale to the interior scale. Things like clutter, lack of privacy, poor air circulation, small things that could so easily be changed by design, where the evidence base has been growing consistently over time, and yet is an underutilized lever for us. So the built environment matters. I don't think we have to make that case anymore. The evidence base has been growing. The causal chain is now clear. Institutions like RISE are working at the intersection to make that evidence base go all the way from longitudinal studies in the field to neurobiological markers in the brain, right? We're working on that. And we know that this causal chain is clear. Poorly designed environments can affect chronic stress that can affect disease burden. So this case about the evidence base, yes, it needs to get deeper. Yes, it needs to get more sound, but it also needs to be more evident. Emerging research also shows that simply viewing our environments, surroundings, buildings, streets, sensory cues can directly affect our body stress systems at a neuroimmunological level. I'm quickly showcasing some work by Dr. 𝗕𝗿𝗆𝘆𝗀 that says even the design of facades can have a neuroinflammatory response. It can activate the brain's stress pathways, influencing hormones, inflammation, long-term health. Think about that. Think about how much stress we are putting on our bodies and brains passively, because once you've built something, it stays. I will share one little data point, for example, that the risk of developing the two most prevalent mental disorders in the world is 71% lower in urban dwellers who live near green spaces. Marco talked about the pocket parks. Those are not expensive interventions, but imagine the difference they could make. And this was actually published, the relationship between the warming world and the changing minds was published in Neuroscience. So the work that we are doing with partners like the Center for Houston's Futures and Project Medics and the Global Brain Economy and so many of you is around thinking about the city and the health of a city as a vital sign in itself. We measure our vital signs for heart health and brain health. Shouldn't we measure it for the city? So we can answer this question, is your city and your building and your environment supporting you or draining you? So that when we look at where we live, whether it's a workplace or housing or a neighborhood, we can look at all scales, from the urban to the street, to the building scale, to the interior scale, be very clear about the design elements, understand what it does to cognition and human health, understand the outcomes, and be able to measure it. Harris talked about it briefly. We recently did, with the Center for Houston Futures, a vital city convening. And from that was born this idea of developing a vital city index. This is in place right now. It is going to be a very robust computational model based on the neurobiological studies that are already out there. Dr. Maria Christofi, who is a Building Brains Coalition scholar, is working on this, so stay tuned. We hope to be able to announce the index overall. And Rim, I think we need to work with your team to make sure that we validate these different frameworks. But the ability to look at a city and to look at data that's readily available about a city and be able to see, is it a stressor or protective? This is looking at two neighborhoods just in Houston between Katy and Montrose and being able to score it. Now, again, in progress, it's part of the Building Brains Coalition. We've invited others to be part of it. This is something that we are very excited about because now we can talk about the potential of cities in a computational way, in a cognitively informed way, and most importantly, in an actionable way, because we are in practice. It is time to rethink the built environment as a strategy for the brain economy. And we have the tools, and we can think about it at a really small scale. For designers, this comes intuitively, but the smallest of spaces are stress inducers and are working against you actively. Smallest of places. It could be at the workplace scale, thinking about really all of our workplaces being living labs for brain health and thinking about what a brain healthy day in the life might look like. It should be at the urban scale, thinking about all the ecological parameters. And really, this is, again, Houston thought about in terms of transit systems, workplaces, access to nature, infrastructure, environmental quality. It isn't hard. And most importantly, it's an asset we already invest in. There's some work that we're doing right now, really digging into awe, belonging, and creativity, because we realize human creativity and the role of the built environment, and that is really important. We invite others to join us. And we are working on developing this coalition because where we are right now as an industry, we cannot and should not try to make any change by ourselves individually. So the Building Brains Coalition is a coalition, very informal. Again, I'll call out Helia and Devin and Marco as parts of it. It's really about a match.com between neuroscientists, climate scientists, designers, planners to make difference in the world. There's a state of the field report that we encourage you to read, around 100 authors, I think, in it. And we invite you to join us in this conversation. So thank you, Harris and Rim, for giving this opportunity, and I'm looking forward to the conversation.
Well, masterful overview, 𝗬𝗨, from neuroimmunology to the ways that we could easily redesign our office spaces, and then some very visceral examples for me of that medical clinic room that certainly touched me emotionally. But then, you know, thank you also for giving these specific projects that you're working on, and again, linking back to measurement. So thanks, 𝗬𝗨. And I think we should also perhaps in the discussion section talk about the financial logic as well, which have really focused my attention to, and many of us, about how do we make the financial incentives work to really pull through all this great science into practice. So that is wonderful. And I should also mention that 𝗬𝗨, with HKS, grateful that we'll be having a conversation next Monday at UCLA about an LA city brain economy initiative. Interestingly, with Los Angeles, so they're interested in a brain economy city approach in the lead up to the 2028 Olympics. And just wanted to make a mention of that, to thank you, 𝗬𝗨, for your team for helping with that, and also to Kana on MHI as well, supporting us with that. So without further ado, over now to Jeff Merritt, who runs urban transformation for the World Economic Forum, the Center on Urban Transformation. Jeff, welcome your remarks this morning.
Excellent. Well, thank you, Harris. Thank you, everybody. Great to join you today. So, I'm the last speaker in these sort of interventions before we go to discussion. And so perhaps I will use my sort of comments here as a segue of sorts. So far we've talked about how brain health and the brain economy matters, how cities can provide a catalyst for action, provide sort of a vehicle to capitalize on this opportunity, and also kind of dug into a series of specific efforts that are underway. And my hope here is to almost take it up a level here and connect the dots and paint a bit of a picture for how these efforts could come together to drive systemic change that can endure and scale. I think, in starting this, it's perhaps helpful to state the obvious that if you look at much of human history, there's this pattern that we repeat again and again. We've built entire economic systems on assets that we depend on, but we don't properly value. Nature is one of these, and increasingly the human brain is another. In both of these cases, we've treated these sort of assets as if they're infinite. Right. And now we're beginning to see the cost of that assumption. As Kana noted when we started this out, that sort of human advantage report that was published this year, they put a number on this, right? The brain-related conditions account for nearly a quarter of the global disease burden, and that scaling proven interventions can unlock up to $6.2 trillion in cumulative GDP gains by 2050. And it's important that that's not just a health statistic, it's a case for investment, right? And that case should feel somewhat familiar because we've had to make this type of case many times before. And in particular, we and my team at the World Economic Forum recently has been making that argument about nature and beginning to try and drive a shift in how cities and a broader sort of ecosystem think about this critical resource. And we're already seeing some progress. That's what I'm going to talk a little bit about here. Now, first off, this isn't about acknowledging that nature is beautiful or it's worth protecting in principle. We've been doing that for much of the last century, and frankly speaking, it's not enough. We've had to build a shared appreciation of nature as a form of economic capital, right? And an acknowledgement that our failure to invest in nature is already showing up in costs, in real sort of economic terms. So going into this work a number of years back, we knew that about 44% of global GDP, that's about $31 trillion that is generated in cities, was at risk from nature loss. However, less than 4 in 10 of the world's sort of most populous cities actually had a dedicated biodiversity or nature action strategy. And so the challenge in this case wasn't evidence. The evidence was there. It's actually, how do you turn that evidence into a system that we can act on at scale? And so that's really what we sought out to do with this effort on nature positive cities. And my view is that there's some lessons here that could be applied and could provide a bit of a sort of path forward to help us go faster when we look at the brain economy. So I'm going to talk through pretty quickly 4 things that I think made that work and are efforts that we could look to sort of replicate. So step one. Step one here is really identifying the right leaders. And you have to be very deliberate about who you bring in at the get-go. In our case, that meant cities, it meant businesses, civil society organizations that were already operating at the frontier of this space, taking nature seriously, even if that wasn't yet mainstream. But just as important as who you bring in is how you structure them. So we created sort of 2 distinct layers. On one hand, there was a global commission of top-level executives. That's mayors, CEOs, heads of civil society organizations that could champion the work and give it political and institutional visibility. Then we had an expert task force of practitioners that could go deep, developing the substance, the metrics, the roadmaps, a lot of what we kind of are talking about here. And this is important because visibility without substance doesn't move systems, and expertise without leadership doesn't scale. So the brain economy is going to need both. We need champions who could shift the frame, and then we need practitioners who can make it concrete. Now, once we identify those sort of leaders, how do we build a platform, right? Not just a movement. We don't just want to, be coming together in forums like this. We want to create a mechanism that can enable these ecosystems to really sort of thrive and grow on their own. So what we did is we designed a really structured set of ongoing engagements focused on peer exchange, shared problem solving, and learning what was actually happening on the ground, right? Going from theory into real kind of practice here. And, we were deliberate about making it work within real constraints. We acknowledge, particularly when you're talking about top-level executives, you have limited time, competing priorities, different starting points across cities and sectors. And so the goal here isn't just to connect people, it was to be able to turn a group of individuals into this sort of functioning system and self-sustaining ecosystem. Now, as you're probably aware, the Brain Economy Action Forum's already doing something similar. There's more than 20 leading organizations that are beginning to move from sort of agenda setting into coordinated action. So the question here for us is really, how does this scale? How can you build the infrastructure that lets the next, say, 50 cities or the next 100 companies plug into something that's already sort of running, where there's a lot of momentum and wind behind you? So that maybe brings us to sort of maybe step 3 of 4 here. And that's about leading with economics, not just aspiration, something that we've talked a lot about here over the last hour. And this is really important to get the narrative right from the start, right? In the work on nature, we didn't lead with aspiration. We didn't open with biodiversity loss as a moral issue. We framed it on economics, return on investment, cost of inaction, long-term competitiveness. And that shift matters more than it sounds. When the conversation is about values, it's easy for leaders to agree, and then they deprioritize. But when the conversation's about risk and return, it becomes much harder to defer. And we're already seeing this play out, that cities are embedding green investment into their economic strategies. They're not doing that out of idealism. They're doing that because the return is becoming undeniable, even as national level politics are fluctuating and creating headwinds in many cases. And so the brain economy report that came out earlier this year begins to sort of move in that same direction, framing brain capital as a strategic economic asset and making the case that underinvestment is already showing up in burnout and skills gaps and lost productivity. So the opportunity here is to carry that framing through to the people who control the decisions, the finance ministers, the city planners, the corporate boards. So the last sort of step here, step 4, if you will, is translating that ambition into tailored action. And in this case, I'll just show you an example of some of the sort of outputs here in my hometown of San Francisco. And what you're sort of seeing here is the outcome of a series of sort of dialogues and discussions where we brought those stakeholders together, right? The practitioners, the experts, the peers, and focused in on a particular place to help to drive that place-based strategy in a way that was really made it easy for the city to just sort of act, right? And you know, with cities, we work directly to help them understand where they were starting from, their strengths, their gaps, the biggest opportunities, a SWOT analysis, if you will, and that led to these very tailored roadmaps. And I'll just quickly sort of show you here, right? This is really doing all the basic work for them that enables them to go beyond sort of talking about issues to implementing. Again, a bit of this sort of SWOT type of analysis, understanding where they stand on governance, on policy and regulations, on financing, their quality of their data and their analytics and stakeholder engagement capabilities, really kind of beginning that action plan for them. I can sort of share this out, and we've done this for each of the cities in our global commission, but perhaps most importantly, what this provides is a template by which you go from broad level concepts and frameworks into customized action and movement on the ground. And, you know, that was front and center in San Francisco just last week. San Francisco had its 4th climate week. So just 4 years ago, we started a climate week in San Francisco. It's now one of the largest in the world. They rolled out their climate action plan with an emphasis on nature at our baseball stadium here downtown in Oracle Park, with hundreds of leaders from business, from civil society, from the communities, all coming together to launch an updated climate action plan that now includes a section on innovation and the role that the private sector can play in helping meet shared goals, right? This is really that kind of what happens when you can help bring together public and private around a shared set of ambitions. Our view is that this is a model that can be replicated and can help the work on brain economy really accelerate very fast. And so last, I'll just sort of end that, the reason that this is, I think, so important right now is that we're at this important sort of inflection point, that in the case of nature, we spent sort of decades building the economic case, developing the frameworks, identifying leaders, connecting systems, and it's changed how decisions are getting made. We know that hasn't held everywhere, right? The political conditions shift, and that's why oftentimes, we have to make sure that we double down here, that we're being very, very intentional about sustainable systems and processes. So the brain economy is at an earlier stage. The economic case is still being established. The systems are still fragmented. That means there's time to build a firm ground, to embed brain capital, not just in policy, but to really change the way in which businesses invest, cities plan, and how finance flows. So I'll end with that we know what the model looks like, and really the question now is, whether we build it with enough urgency and with enough depth that it holds. And thank you, everybody. Back to you, Harris.
Well, very powerful intervention, Jeff, and thank you for providing us with that roadmap of sorts for us to follow, to build something that is leveraging the experience of that nature positive cities initiative. I'm very inspired, and I put my hand up to be involved, but I was already involved. I hope I'm getting a lot of messages from folks that we definitely need to do this. We need to create the cities initiative, as Marco said, some sort of like highway between cities where we can exchange learning and best practices and people and expertise. So this is terrific. Very inspiring start to the morning for the people on the West Coast in particular. So, okay, now let's continue this this theme of discussion and synthesis, and recognizing, Jeff, you've now laid out a roadmap for us. I'd like to hand it over to 𝗕𝗿𝗶𝗀𝗆, who's coming to us from Rice University from the Kinder Institute for Urban Research, where 𝗕𝗿 is the Associate Director of Community and Public Health. 𝗕𝗿, we'd love to get your perspectives on what you've heard so far today, and any wisdom that you'd like to share with us.
Sure. Thank you, Harris, and thank you to all of our experts for really thoughtfully walking us through this perspective and the different angles that we can come at this from. And I think one of the things that comes up for me in listening to our experts and thinking about this topic is how these ecosystems and this idea of brain economy can really be thought of as preventative. So if we think about moving beyond reactive brain health models and towards these place-based preventative ecosystems that can strengthen not only cognitive, but also physical, social, even economic resilience across the full life course, I think this can help produce more buy-in in the idea as well. So thinking about from youth and educational attainment into workforce participation, midlife transitions, and then into healthy aging, ultimately, cities can, of course, shape the structural conditions that determine lifelong brain health. But when we're designing these, the question is then, for who are we designing these ecosystems and these systems? What is the intended end user? And that will then ultimately tailor, that their design, because of course, someone who is in the workforce versus someone who is an older adult might benefit differently from a structural condition or a certain system that we implement. And so when we're designing these, really thinking about who that person is and how it might change the way in which we approach that design, I think could really lead us towards more preventative models. And so pulling from what Marco said earlier about designing not only with intuition, but intention, I think this is a way, as Jeff just mentioned, to help customize these actions. So, of course, this is thinking largely about, health models and often healthcare systems and how that supports these lifelong, health span trajectories, but also prioritizing, as we've been talking about, those social, environmental, and even economic foundations that protect health before decline can begin. And I think some of Houston's emerging data, which I'm happy to share if we have the time, from our institute and some of the work we've been doing with Project Metis, as David mentioned, can really be a powerful local example of how these dynamics unfold. But the broader lesson is really globally relevant, and that is that cities who invest in prevention across the lifespan can be better positioned to drive sustainable cognitive prosperity. And so I think ultimately continuing to build data that supports this perspective can help create that buy-in that will really boost the financial resources that we need to produce outcomes.
Wonderful. Thank you, 𝗕𝗿, and fully aware that there's a deep amount of data that you have at the Kinder Institute. Maybe let's put a pin in that, see if we have time to come back to that later, but very grateful that you mentioned that. And it's wonderful just to have an urban research institute at the table. It's critical, as we talked earlier about science and the robustness of this work. So maybe it's a good point to mention that, again, to reinforce the point that David said about the Texas Brain Economy Summit in Houston, Texas, June 9th and 10th. I think the Kinder Institute will be there absolutely in force. So we can also dig deeper into the Kinder Institute's data and research methodologies. And
Sure.
and also Jeff Merritt will be there from the World Economic Forum as well. So let's continue this conversation, particularly around Houston and how to support the Houston model to move forward. That will be something to look forward to in the next month or so. Anyway, thank you very much, Hannah, for your points and for also your support of Project Medicine engagement there.
Absolutely.
And so to turn to the next discussant, 𝗕𝗿𝗁𝗃𝗃, who is the Research and Insights Lead at Arcadis. Helia, what are you making of the intervention so far in the discussion? Welcome your thoughts.
Thank you, Harris and Rim, for having me here. And it's I'm so happy to be in the room of brilliant minds and people who connect the dots and think big and think in the systematic way. So I think a couple of things spoke to me throughout this conversation of people who I known for a while, like 𝗬𝗏, you, Harris, and people who I'm becoming to know more. I think one of the things is that what I'm hearing is that we want to expand the health span to their lifespan. Like we want to make people have the healthier life from the day they born until the day they pass this earth. So I think that's one of the key points that I wanted to point that out, that I've been hearing over and over in this conversation and other places as well. Another thing is that we have been for a while oversimplifying a very complex problem, a very complex thing, and we just can't afford doing that anymore. And I think these conversations that we are having of, bringing people from policy, from economic background, from psychology, from neuroscience, from architecture, education, all of those things, these are some of the conversations that we really need to have even more. And I know all of these summits that we are having in Houston, in LA, in Brussels, all of them are kind of a way that we are bringing all these minds together and just thinking in a more systematic way, as Rim very well mentioned. We need to have more systems thinking approach, because the relationship between like brain and building or brain and health and all those things are very important than the silos itself. And as Kiana well mentioned, 1 + 1 is 11 or even 100 or 1,000, I don't know. It's just very huge. And one other thing I wanted to mention is that the measurement, which is very, very important. And it's just too risky not to measure. And I think that's what we are hearing from what 𝗬𝗏 said, what Rim is saying about the indexes that we are having, what Marco said about those measurements that they are doing in the lab. And I think we have been doing a lot of assumptions in the built environment throughout the years. And it was all about, sometimes it was just about aesthetics, about how you define aesthetics, right? And sometimes it was more about assumptions. And I think one of the excuses was that it's just so hard to measure. We don't know what to measure. We don't have the tool. We don't have the time. We don't have a budget. But I think having these indexes and having, more easy access tools to measure some of this impact is one of the keys that bring us toward that measurement and the importance of that. And that now we can measure, even though it won't be complete, even though we can't measure in all of the projects, but always good to even start small, and then move to the learn from the past projects. And we are also helping our clients to be more proactive about such things than reactive to what you just said, Hannah, right? We want to be more having a preventive aspect than like reacting to other things. Yeah, I think, and I believe the last thing that I want to say is that awareness and agency is the key. And again, I'm hearing in this conversation as well, we have to bring awareness about the impact of the building on people, so that people have some agency over their health, whether they are, population, or they are policymakers, or they are architects. But these are the quick points that I'm a connector, so I have a list of connecting dots. But yeah, very much happy to be in this conversation. And thank you again, Harris and Rim, for having me.
Thank you, Helia. Your perspectives mean a lot given the vantage point that you have, leading research and insights for a global company that does this day in and day out. I think what you were saying before, your company has like 36,000 employees and more than 200 offices around the world. So having your points there, lets us know that we're on the right path. Thank you very much, and it's great to have you on the journey with us.
Thank you, Harris.
Now I'd like to turn to Patrick McNamara, who's the CEO and president of the Palm Health Foundation in South Florida. And Pat leads the Brain Coast project, which is a very impressive place-based initiative. Pat, what do you make of all of this, and perhaps how it could relate to Brain Coast?
Well, first of all, thank you so much for including me in this conversation. And anytime I get to spend time with Kana and Harris, I learn so much. So this is also a great precursor for, in just about an hour, I'm going to be heading up to give a presentation to our Economic Council in Palm Beach County about the Brain Coast. I'm still taking in so many of the perspectives that were raised this morning, and how that is going to factor in, and also looking forward to going out to Houston and further meeting the folks who are doing such great work there. So so much of this is applicable. It's really all applicable to what we're trying to do in the Brain Coast, particularly with the amount of development and the changes that have gone on in Palm Beach County and particularly in the city of West Palm Beach. I started to share a vision a couple of years ago, riffing off of the fact that we all refer to the middle of the state as the Space Coast. It transformed that region because of the investment, the science, the determination to reach the moon, and we still have these incredible things to show for it, with the most recent example with the Artemis being launched from the Space Coast. And so most people still don't know that we have some of the world's top neuroscientists in our backyard in South Florida. And I've recognized that for the past several years. But bringing what we have to offer out of not only the neuroscience labs and for health implications, but into the economic implications is terribly exciting, and the timing is perfect. We've also become, quote, Wall Street South down here. That happened during the pandemic. So the potential for implementing what we are proposing to do through the Brain Coast is transformative across sectors. So I'm terribly excited about it. I approach it from the standpoint of more of a social neuroscience kind of standpoint. My background is trained as a clinical social worker, and I always tell people that if I had been trained 30 years ago with what we now understand about the way that the brain works, my training would have looked very differently. And I think that's the other thing in terms of brain science. Over the past 30 years, the implications of what we now understand are profound across sectors, and it's really applying that understanding.
Thank you for sharing all of those points, Pat, and for the work you're doing there in around West Palm Beach. It's been wonderful to meet you and to establish our relationship and friendship, and the dialogue is so fruitful with Brain Coast and Project Metis, for example. I know that we're exploring, you're bringing a delegation from Florida to Texas in June, and then we also hope to be with you in Florida, perhaps around the latter part of this year, given that you have proximity to the head of state meeting of the G20 there in Miami in November. But Patrick, thank you again, and we look forward to ongoing dialogue, and and hopefully viewing the Brain Coast as key in this emerging brain economy cities initiative that we're putting together. We'd love to involve you in that. So thank you, and good luck with the Economic Development Board later today.
Thank you.
And now, last but not least, 𝗕𝗿 Kleiner from Perkins and Will. 𝗕𝗿 is the Director of Regenerative Design at Perkins and Will and a principal. And again, interestingly, 𝗕𝗿, you're bringing in the regenerative approach. And I guess there's a strong theme here today, isn't there, between nature, regeneration, climate, and the brain. But 𝗕𝗿, thank you for being involved in a number of our events in the past. What are you making of the latest discussion here today with all of the speakers and experts that have had input so far?
Yeah, thank you, Harris. This has been incredibly insightful. So I appreciate, all the comments and the building. I feel like there's a couple threads I'd like to try and stitch through. And to 𝗕𝗏𝗆's point about the Building Brains Coalition is no longer about holding cards tight, but we don't have time for that. So we need to be sharing ideas at all multiple scales. So I do want to share at least one example of how this can be implemented as well. So there was the point about public-private partnership around shared ambitions that Jeff spoke about that I found really interesting. Marco touched on the city-to-city partnerships, and I'm curious if maybe scaling that also to university. I think there is interest from universities, again, not holding their cards tight. So I want to give an example to that. And then Marco also spoke about neuroarchitecture and designing with data and measurable impact. And I think universities are a really great spot to build on a lot of the thinking that's happening. So there's an example at Western Washington University, working with the computer science folks. We just recently completed a project up there called 𝗂𝗍𝗄𝗃. It's zero energy, zero carbon, mass timber project right adjacent to an arboretum. Another idea that came up earlier, right, is that Jeff mentioned nature's there. How do we kind of take advantage of those adjacencies? So building right next to an arboretum. And so we created a research partnership, again, this kind of public-private partnership, and started doing some research on getting a post-occupancy evaluation for folks that are familiar with that. It's how do we understand how a space is truly performing, but using technology enhanced. So using smart shirts and Fitbits and getting that measurable data that starts to inform what were those design intentions and where did we go wrong? Where did we go right? Where do students choose to spend their time? How are their, the anxiety level, the stresses, their heart rate, and where do they feel comfortable? So it's a way to get that measurable data, and that partnership's just started, but really excited. A lot of what I was hearing here, I think, ties into that specific example. And one other one, 𝗕𝗏𝗆 showed some really wonderful examples of all the scales. I love the urban scale, the street scale. The image you shared of the patient room looking out, really struck me. I think we all probably felt that. Harris mentioned that as well. There's an example at Swedish Hospital here in Seattle. It's under construction, where we had to show the value proposition for why there should be a sky garden in the entry lobby that can help reduce stress for the caregivers, the family members, increasing productivity, all those metrics that we saw earlier. And so I just wanted to give a tangible example of that value proposition, which they embraced and said, we get it, we agree, let's spend that extra capital, initial capital, to help build the brain capital. And that brain capital, as we all know, builds that healthy brain economy. So just wanted to share those few examples. I found this totally inspiring. What I'm taking from this, and hopefully others could as well, is the multiple levels of engagement, right? We're having a webinar. This is awesome. How do we carry that into our daily activities? The clinicians we're talking to, whatever it is that we are engaging with, let's talk about brain health and let's daylight this, because I think it's still relatively new to a lot of folks. We're all becoming familiar with it, but there's an educational component. So I'd encourage us all to take that to our daily interactions. And thank you again, Harris, for the opportunity.
Brilliant. Thank you so much, 𝗕𝗿, for your engagement at the strategic level, and then also tangibly with projects and propagating this through the real world in your day-to-day. It's interesting as you're speaking, like propagation, as we've heard from yourself with talking to clients, but then also a number of our colleagues here on the line have established networks, whether they're from research projects or other sorts of networks. So just the small amount of people on this call actually can propagate a very long way, and not least of Marco talking about some of the city networks in Sweden, for example, that can be influenced. So anyway, thank you, Devin, very much, and we look forward to continuing to work with you and Debbie and the Perkins and Will team. So we have pretty nearly kept to time. So let me just say a couple of points in conclusion. Beyond gratitude for all of your time this morning, we clearly, given the energy and the amount of sort of data and insights and motivation, we clearly have to do this Brain Economy Cities initiative, and it can and should be global. Some of the tips that Jeff gave us is we've got to think very much about the right kind of leaders from across different industries, public, private, philanthropic. We have to think about how we structure this, a couple of different levels of structures of commissions and expert groups and advisory boards. So we'll take that on board. We have to really think hard about programming, exchange opportunities, sharing best practice models. Rim has mentioned the measurement point very well. We absolutely can tailor measurement to the city urban level. Marco's nodding his head. 𝗕𝗿𝗶̱hi has obviously already thought about this in regards to vital cities. So I think there's plenty of programming opportunities, and we probably just have to think about how to prioritize. And then getting from, as you said, Jeff, from ambition to action. So what is the roadmap for how to roll this out? So plenty to think about. And I think we will be unpacking this next week in Brussels in detail, and then again in Houston in June. So with that said, thank you all again for your contributions, and we will be in touch very soon to wire up how to move this to the next stage. Thank you all.
Thank you, Harris.
Thank you all.
Thank you so much.
Thank you.